Hey, Dr. Rob Kiltz, how you doing? We're just getting started in just a minute, so hang in with me. Enjoy the fertile fireside chat, getting just set up here patiently. All right, we're getting moving here. Hello, everyone. Dr. Rob Kiltz, the Fertile Fireside Chat, here for the next hour, 8 to 9, every Sunday, live. But you can always get all the reruns, by the way, through the week. So just give it a minute for people to launch in here and join us. Hello, and God bless to all. Hope everyone had a wonderful Thanksgiving and focused on gratitude. Hey, William and Michelle Boatman, how you doing? Tamar Holman, how you doing? Good evening. It's a beautiful day in the universe, and here we are all joining together on this beautiful Sunday, the 25th-ish, I think. And again, gratitude, Thanksgiving, and I'm so grateful to everyone in the local, the national, the global for sharing your likes, your loves, and share with everyone. Remember, this is about improving your Ferrari, your most amazing, expensive, irreplaceable body, and taking care of it in the right way. And so that when you do that and you're looking to have a baby, you'll be more fertile than you ever imagined. And remember, you got to have faith and think of it right here that that which you desire will come true if you hold the dream and never let it go. And again, always a pleasure to everyone. The shout outs, the thanks, the gratitude, the likes, the loves. And really, we're working really diligently every day to bring love to everyone. And this is the most emotional, stressful, difficult process. And through this holiday season, it can be even much more challenging. And we all have something emotional, challenging. All of us, we're human beings. It's the nature. Sadness, depression, anxiety, fear, worry, anger. We've got to step back. I'm always pulling out my journal and writing things I'm upset about, I'm sad about, I'm angry about, but mostly I work to write something about my gratitude. And if I can put more about positive in the bucket, and when you think positive and ink it, it's amazing how the vibration comes to all of us. And we're all sharing together on this journey. And through CNY Fertility Facebook Live and the support groups, and listen, not just CNY Fertility, but all those groups that are out there supporting each and every one of us, because we all need it. It doesn't matter your gender, your relationship, single in a couple relationship, or there's something more going on. We're all human beings. And all of us need to learn how to step back, share love, patience, faith, and joy. And we're going to get started on some questions. At See My Fertility, we're open to all ways. If you got some ideas, bring them to us. We're always interested in looking and learning every single day. And let's see, Jennifer, hello Jennifer and Christina. And again, from everywhere, from Ohio, from Lubbock, Texas. Let's see, we had people from Texas, Tennessee, Minnesota, California, Alaska, Hawaii. And we're really working hard to make fertility more affordable, accessible to everyone. At See My Fertility, we offer full financing for everyone, and we're working to extend them beyond 3 years to 5 years and making it easier. But it's not easy. It's not cheap. Listen, no matter what, even at See My Fertility, it costs something. And we still work very hard and try to integrate Eastern, Western medicine, a lot of faith, the power of positivity. I talk a lot about positivity, and what you put in your mind, it really matters. And so, get a picture of you, your partner, your family, that which you desire and dream. Put a vision board up. Keep it on your phone, on your mirror, wherever you go. And every day, hold the dream of that which you desire it to be, and be happy today and thankful for this amazing relationship called life we're all enjoying in so many ways. So again, my gratitude to everyone out there. And let's see, Mississippi, New Jersey, I saw Utah. Hey, Stephanie, Jennifer, Jess, Pri, grateful to everyone. And I had a question today, a text message about a protocol, estrogen prime. And then day 2 or 3, start the antagonist, cetrotide for like 5 days. Then get your baseline and then start your stimulation, somewhere between 300 and 600 of gonal menopur, gonal HCG. And then when your lead follicle reaches about 12 millimeters, start your antagonist. We usually like to start the antagonist about day 5 in the evening, day 6 in the morning of the stim protocol. And we're interested and excited to look at all sorts of new protocols. I mean, this is really how I learned about human growth hormone. We've been using a lot of human growth hormone to build the ovarian function, blood flow, and maybe even for guys, we should be using HGH gel, HGH sub-Q, and don't forget about human chorionic gonadotropin, HCG, for the guys and the gals, especially the intrauterine HCG wash to help with implantation, and sub-Q booster shots we also use. You got to be careful on that one because that pregnancy test is going to turn out positive, and so you got to follow it a little bit more. So again, gratitude for the likes and loves, and we're giving away an IVF cycle or an equivalent, and you're welcome if you win it and you don't need it to pass it on. We've been working with Integrity, Freedom, Metro, many pharmacies, but our Integrity pharmacy has really been helpful in getting lower and lower costs. We've been working on a lower cost IVIG, intravenous immunoglobulin. Listen, the immune system, inflammation in our bowels and our body is the culprit for every disease, every one of them. And I'm sorry, fruits, fiber, vegetables, they're carbs, they're sugar, they're damaging and deadly for us if you have them too frequently and too much. You gotta add the fat. And Kiltz is keto, bacon, eggs, butter, beef, and I just added the I for ice cream, B-E-B-B-I. And remember, it's Kiltz's ice cream. And you got to Google it and look it up between my steak and ice cream. And I know I'm boring, but I'm telling you, the spice of life and variety is deadly. You want to slow it down. You want to narrow it up, not throw too much at you, by the way. And I know I'm throwing a lot at you today. So Ohio in Buffalo. How you doing, Tyler? Yes, from Tyler. Amanda, how you doing? Danette, Shauna. And I had a wonderful Thanksgiving, by the way. I hung out with some good friends. Guess what I ate? Yes, ribeye steak. And I had my ice cream. And I shared it with everyone, and they really loved it. But I did have a little bit of turkey with some really great giblet gravy on it, too. My friend Roz, Richie, his family, everyone's families were there. It was just really spectacular. And, you know, it's a tough thing during this season to spend time with family and all the chitter chatter that goes on. And we take it personally, all of us. I've taken plenty of things personally and gotten angry and upset and run away. But we have to imagine that God is always working in our favor, and everything that comes at us is good for us, hard as can be, I'm telling you, because I practice it every day, and it sometimes like gets me really, really tough. And if you haven't read Don Miguel Ruiz, The Four Agreements, highly recommend it. All right, let's see if we can get some questions here. Jerry Black, endo stage 2, recipient IVF, reciprocal, what meds for transfer? Okay, so remember, endo is inflammation, and whether you're getting embryos placed in you or you're collecting eggs or collecting sperm, we got to make the human Ferrari, men and women, the very best. Keto, keto, keto. We've been using a lot of CBD oil, cannabinoid oil, CB distillery. There are lots out there. We are selling them at our CMYC fertility centers. And then low-dose naltrexone, and look it up. Look up I got one of the books here for low-dose naltrexone. I highly recommend you guys read the stuff we talk about. There's some great literature out there on CBD oil. It's an anti-inflammatory, omega-3s. Whether you put it on the skin or put it under the tongue, there are some suppositories. There are lots of different ways to do it, and there's even vaping, by the way. So find something that feels right, but read about it and try to gain some knowledge yourself. I'm not telling you what to do here. I'm just sharing with you some ideas that you might find helpful. Keto, CBD, LDN, and we're doing often a course of antibiotics because there's a lot of inflammation in the uterus, the cervix, the endometrial lining, and then quite commonly just for a frozen or a fresh embryo transfer into a recipient, and we're doing a lot of frozen embryo transfers. We do a lot of estrogen for 7 to 14 days, and we like to see that lining 7 millimeters or greater. And even when it gets into 13, 14 millimeter range, it's okay. And then we usually transfer on the 4th or 6th day of progesterone, depending on a day 3 or a blast stage. And more we're using the ERA, the endometrial receptivity assay, and now we can do it in New York, hallelujah, and Atlanta with Dr. Avi Verdialis is awesome. We're doing monitoring there as of the beginning of December, I think the 3rd, Monday, Wednesday, Friday, and I'm really pushing to get 6 days a week starting in January, February at the latest. And we're looking for a ultrasound tech, and we're going to be adding some nurses there also. So really grateful to everyone as we grow that. But we have monitoring centers, Buffalo, Syracuse, Rochester, and Albany, and our labs currently are in Albany and in Syracuse. And we're seeing clients from all over the country and the world, and we're really encouraging everyone, talk to your OBGYN, talk to your local radiologist, your hospital, talk to your REI, your fertility docs. You know, we believe that we can grow the fertility knowledge and the help out there and make it more affordable by sharing these methods, by the way. Let's see, Jennifer Ham, how you doing? Conceive first and second cycle after reversal is done. Due next month with our specialists here. Awesome. Congratulations, by the way. And listen, I do laparoscopic reversals. They're not perfect, but we are getting babies. And it hasn't been that long yet, but it's a 2-hour procedure. We charge $7,900. It includes an IVF procedure. So if you don't get pregnant or it closes up, we're here to help and make it better for you, by the way. Let's see. Hey, Amy, Melissa Burrison, Utsig, a pleasure. And if I mispronounce anyone's names, please forgive me. Hey, Justine, our Albany team is amazing. Justine Taylor is one of our awesome, amazing nurses. I got the best teams. We want your feedback. We want your frustrations, your whatever, your critiques. I even got like a long text from someone I've never seen that said, thank you, great team, really wonderful. I share it with the team. They feel inspired and they want to even do better. But we are really grateful for everything that comes our way because we want to make it the very best for you. And Keena Bryan Bussard, California, and we really have an amazing docs, practitioners, nurses, front office staff, back office staff. Our maintenance team is amazing. I won't even mention because it's like I'll miss some of them, but really a pleasure. And Rebecca Vingy to Brittany, do not give up. Persistence, prayer, positivity. It's really something that we all need to focus on every single day. And if you haven't looked at my book, The Fertile Secret, check it out, Amazon. And we just came out with our new magazine. We're sharing it out there. And again, your ideas and you got to share it with us. Let's see here. Hi, Diana. Let's see. William and Michelle Boatwright, 40 more days and we'll be heading New York from Georgia. A pleasure. And I know Remember, during the waiting period to get the consult or meet with our docs or practitioners or talk to us or get started, remember, keto, keto, keto. Kiltz is keto. That's the home run, by the way. I call it the Ferrari plan or the Lion King plan. And there's also Emmerich Keto, Maria Emmerich. You got to get onto Amazon, buy her books. She's amazing. We are working on a store that you get it all directly through CNY Fertility, and we're working on making sure everyone gets discounts, affordability, quality in all ways. And Karen Atlas, a pleasure. We are, let's see, so Chelsea Nicole, how you doing? Let's see here. I'm on Clomid 50 milligrams and metformin 500 and just found out I have PCOS with another cyst on the right ovary. Normal period, not overweight. I've already had a laparoscopy previously. Small spot of endo was removed as well as scar tissue. Right tube is damaged and has been reopened. Multiple miscarriages, low progesterone, and an ectopic. A lot of inflammation. Remember, it's so simple. Inflammation is the cause of all of our problems. And that inflammation comes from the bowels, and it comes from glucose, carbs, plant antigens, plant phytochemicals. Fiber is deadly, and I'm sorry, it's effing us up. And probiotics are deadly, deadly, deadly. Don't touch them. Oh, exercise. Slow it down. Cool the body. Cool it. Cool the mind. Cool the heart. Cool the bowels. And that will cool your reproductive organs and get the blood moving and better. And remember, you gotta have sex if you're trying to have pregnancies the natural way too, by the way. And if you're doing IUI, IVF, donor eggs, whatever it is, still have sex. All right. Low progesterone, ectopic, what would you recommend, IUI or IVF? Well, all right, Chelsea. So ectopics, tubal damage, it all drives the conversation to IVF. If you have a bad tube and a good tube, get the bad one out. I've seen so many pregnancies just happen when you get rid of the bad one. Those bad tubes harbor all this inflammation and infection. And going to a 30-day antibiotic and even some diflucan and antifungal may be necessary, by the way. But number one is Kiltz's keto. Bacon, eggs, butter, beef, bam, baby, once a day at night, rest and digest. And remember, feed them, fuck them, and put them to bed. Sorry, I'll be better. All right. So we all need to be focusing on our relationships. It doesn't matter if it's female, female, male, male, or female, male, but we need to be taking care of that part of it. And we get upset and we need to find love in our thinking for those people in front of us. And remember, when you're looking in the mirror, you got to think the same thing. You got to love that person in the mirror first so you could turn around and love everyone else around you. So IVF is what I recommend, but remember, keto, CBD, LDN, antibiotics, get rid of the bad tube, and IUI still could work, and look at a full immune protocol, by the way. And how are we doing tonight, by the way? I got my clock over here tonight. We just having fun, enjoying and sharing on this really, really hard journey. I went and visited a good doc, Dr. Joel Batsoffen down in New York. Awesome guy. He did a book on one step at a time. And remember, every day, all we're doing is one step at a time. We're worried about yesterday, we're worried about tomorrow, but remember, the present moment is today. You need to focus on the joy of that, even while you're going through this shit-ass hard, you want to use the words, and I'm trying to be good. Chris Ziegler, by the way, is my awesome, amazing practitioner in Buffalo. We love her, we love the entire team, and a shout out for that amazing team, no matter where you're coming from. And we're looking forward, Chelsea, to get with you and help you whenever you're coming this way. It looks like February. I know it seems like a long way away, but keto, kick-ass, is amazing. Kiltz's keto is number one. And the losses that people have. So not getting pregnant is one thing, but to get pregnant and lose it early, later, or late, it is hard for everyone. Talk to someone. Remember, get the journal out, write about it, share your story. You've got to do it. And talk to us. We want to hear and talk to you also. Fertile Hope Yoga with Erin McCullough and Fertile Friends. And Lisa Stack has really done an awesome job. We're so grateful to her and the team. And you know, guys, we got to get guys and our guys group talking and sharing because, you know, we guys don't talk as much. I know I talk too much. And we need to share our feelings, our stories, and never, ever, ever give up either. And, you know, sometimes we all feel like we're getting battered, but we need to hold love, acceptance, kindness, no matter where you're walking and what you're doing in the day, by the way. So let's see here. I think I got most of these. Oh, by the way, many polycystic ovarian syndromes, metabolic syndrome, half of them are not overweight. Weight and obesity does not cause any diseases, by the way. It's a side effect of a high-carb diet, low-fat diet, which basically causes the diseases. That's why we're seeing with keto, all the diseases go away. Hypertension, diabetes, asthma, the allergy symptoms that people have. It is really, really amazing, by the way. Laura Huffman, reciprocal IVF, yes. Yes, we do that. And we're really working to get people that can share eggs, share sperm, share embryos, share a uterus. And talk to us because we're working on ways to get more affordable plans, financing plans for everyone. And if there are meds out there, ways that you can help someone else, pass it around. Hey, Nathan, how you doing? And Jan Wainwright, a pleasure always. Gratitude to Washington, my Amanda and Moses and Lucky. Hello to you guys, my family in Washington, in LA, my daughter and her mom in Princeton, Miss Tia in Florida, and my entire See My Fertility, See My Healing Arts team, and Blue Ocean team. Amazing, by the way. All right, Christina Copley, how you doing? Second failed transfer, going to take a break and do some testing. Look at immune, look at laparoscopy. Remember, keto. And some people do paleo, by the way. Paleo works for a lot. Keto's better. And Kiltz's keto is like the home run. It's a challenge. Bacon, eggs, butter, beef. Sounds boring, right? But, you know, having a couple of boyfriends and girlfriends on the side is not good for us. I know some will say, well, maybe, but no effing way, by the way. Don't do it. All right. Jose, how you doing from Pittsburgh? Always a pleasure. And so immune, CBD, LDN, and keto, and the laparoscopy for endo regarding failed cycles. And then really, you got to add on the IVIG, the intralipids, Plaquenil, even Humira, maybe another one, and then LIT, leukocyte immunotransfusion. Mike Farrell in Markham Fertility, really awesome. We shout out for their team, really grateful. Olivia Blakely, feel about myo-inositol. So inositol, ovasitol, through Theralogics, Ovavite, which has the CoQ10, the vitamin D, and the folic acid, methylfolate, by the way, which is the one for MTHFR defects. And so we're covering a lot of these bases, even though we may not test for all of them because they're really, really common. But I like the inositol, myo-inositol, or the ovasitol for the pre-diabetics, the metabolic syndrome, the PCOS. We think it really is good. A lot of people cannot tolerate the metformin or Glumetza. So this is the one to try, by the way. Remember, keto. It's amazing. All right, I saw South Carolina. Amanda Cummings, I'm so sorry, by the way. And Chelsea Nicole, I think I got most of that. And we'll see you soon. I got to slide down on my iPad, by the way, and grateful for the amazing number of people that are sharing. And remember, share it around. And if you're sharing it on Instagram or any of the others on Twitter, with your friends, your family, because it's not just about fertility. It's about the Ferrari, that it is going to feel fantastic. The energy is amazing. And at 62, no exercise and one meal a day at night. Rarely do I eat anything else. And I believe seeds, nuts, snacks, smoothies, shakes, all this extra protein stuff, and it's not good for us. Got to be careful, by the way. And Joe Franklin, HGH, Somaderm, check it out. Really appreciate what you guys are doing. Let's see, Amy Sword-Ruffin, sclerotherapy for lymphatic malformation with venous structure. I'm concerned that this will just cause more inflammation and hurt my fertility even more. You may have some inflammatory stuff that needs to be removed. I don't understand the sclerotherapy very much, but once again, remember, the lymphatics, the veins, the arteries get a vasculitis, lymphitis, lymphangitis, the lymph nodes get inflamed. Those are all the precursors to getting lymphomas, Hodgkin's, non-Hodgkin's, and all these things. So I would look towards maybe changing diet, keto, some LDN, CBD, and try those sort of things and see if they work. Some support hose and see what that works first, by the way. So, and my gratitude and hugs to everyone, by the way. I feel so grateful that everyone's watching and sharing and liking and loving. And even if you're here just a few minutes, my gratitude out to everyone, because I'm learning from what you have to share with me, by the way. Herbs prior to IVF. Mike is our herbal specialist, and Donald in Syracuse, and then Jennifer also, and Chi. We have amazing teams all over, but you need to talk to the herbalist and get their recommendations. I think herbs can be very helpful. Herbs basically are a phytochemical. They're a pharmaceutical grade herbs that have healing properties, but remember, some of them can be harmful. This is why I talk about plant material, how there's a lot of antigens, latex, lectins that can be harmful for our bodies. So I'm all for it, by the way, but you need to be making sure it's being taken care of properly. Let's see. Oh, you got to be careful on the CBD and THC, by the way. And, you need to check your sources. There's a little bit in it, and if your job somehow relies on no THC in your testing, you may not want to take CBD at all, because there may not be a way to be 100% certain, by the way. But remember, you got to remember that things happen for a reason, and somehow it's teaching us, and we're learning these things. And, if you're waiting for the studies to tell us the answer, we'll be waiting a long time. By the way. And Francis Bertico, how you doing? Let's see. Melinda Alexander Luthi, 1 or 2 embryos. All right. First, second, or third transfers, and you're under 35, we recommend 1. If you're doing a day 3, and it's been 2 cycles, we often will consider 2, but it really needs to be individualized. We don't have a hard and fast and strong. Over 39, 2, and even 3 at times, but it's going to depend on the quality of the embryos, whether they're PGTA, PGS, PGD tested or not, so that's kind of the basics. But 1 and done is what we recommend. Twins have a lot more complications and early deliveries. How's everyone doing, by the way? Drink when you're thirsty. Don't overdo it, by the way. Water dilutes out our system, and I think it's not good for us. So I always say, get rid of the carbs, get rid of the exercise, get rid of the fiber, and no alcohol, certainly marijuana, chewing tobacco. These things are not good for our bodies, by the way. And then slow it down. Hello from Florida, Cindy. How you doing? Linares Dillon. Really a pleasure, and I'm glad you enjoyed lunch. And I hope we see consults that come to all of our centers. They fly from all over the country. You get that consult. you get your bloods, you get your ultrasound, we get your plan, we get you moving forward. And quite often we can get you in faster with the physical in front consult. And remember, if you're not able to make your consult, whether it's over the phone or in person, please let us know so we can get someone in that's been waiting a long time, by the way. Let's see. Herbal medicine can use list would be great. Listen, you really got to talk to the herbalist, by the way, and because willy-nilly just taking everything. I mean, look at the herbalists, the pharmacies in China. They're huge and as large as a Western pharmaceutical, by the way. And it's just another drug. So a lot of what I talk about is less is best, and being positive, and remember, keto is king, and one meal a day at night. These are the ways I think we really heal our bodies, and that's the most important part. So MTHFR, methyl tetrahydrofolic reductase mutations. A lot of controversy, by the way. If homocysteine levels are abnormal, then it's more likely to be a problem, and we recommend taking methylfolate as the treatment. We also recommend the thrombophilia testing. And a lot of this is very controversial, by the way, but I call this more like a blanket approach, right? We don't know what most causes are. That's the answer. Idiopathic, I say we're idiots. My opinion, it's inflammation everywhere, all the time, 100%. And MTHFR is another inflammatory condition that basically is treated with methylfolate, with aspirin, prednisone, steroids, and either Lovenox or heparin. And remember, keep at it. And if you want to get these tests, we'll do them for everyone. I just don't want to waste your money because most of the treatments we're doing are covering these things. We want to make sure you're getting the very best care at the most affordable prices, but we're not cutting corners. All right. I want to make sure you get our new magazine that we'll be sending out to everyone. It'll be on the website. We need your comments about our website, by the way. We're working on some new stuff. And Buffalo, I'm working on it. I've ordered equipment, but it takes time to get it up and running, certified, tested. I'm hoping sometime in the spring or earlier. We may be doing at least frozen embryo transfers, if not doing fresh. And I am working on it in Atlanta and also in the Tampa, Sarasota area. That's my next goal, to make it that we can get some monitoring centers, consult centers, and then eventually maybe some affordable IVF in your location. All right, so Brandy had an ectopic. After reversal, the other tube was blocked. What do? You need IVF, and we're here to help you with that, by the way. And it's always a toss-up which way do you go, but I think both reversal and IVF are good ways. It's really personalized and individualized in making the decision. Let's see, Stacy Gillum Ramsberg, hello from Ohio. And these get a lot of what we're working on is the 3-month priming, whether again DHEA, if you have low ovarian reserve, keto, LDN, CBD, and getting your medications ready, getting some baselines, getting all your testing and your studies. If you want to get genetic testing, we're available to get it for everyone. And there's so many places to go in this country, in this world for IVF, and there are many, many, many great centers, many, many great doctors, and I feel really blessed to be in this field. So at CMI Fertility, we bring Eastern and Western medicine, and affordability is the crown. And we're open to those ideas that you want to bring to us. So much of what we talk about, I've learned from you guys. And I know it seems crazy, and often it's in the doing is in the getting, by the way. Let's see, Kiltz is keto, bacon, eggs, butter, beef, bam, baby, and fatty ribeye steaks. Lean meat is not good for us, by the way. All carbs, that means fruit, fiber, vegetables, and lean meat, and amino acids, they go to the liver and they're converted to sugar, and then they're converted to fat. I'm sorry, it's like a crazy concept and idea. But I know it seems a little nuts, my diet, but if you haven't read Gary Taubes, there's Gary, best book in the universe, Good Calories, Bad Calories, love his stuff. You got to audio it. You'll get a really amazing story and ideas. It's not a conspiracy, but my belief is Heart Association, Cancer Association, Diabetic Association, nutritionists are telling us the wrong thing. They keep on going down the wrong road and they're screaming how great it is, but I'm sorry, kale, Brussels sprouts, broccoli, and asparagus have phytochemicals, plant antigens, and they're fiber filled, and they're all sugar, and they're not good for us. I'm sorry, and I know I sound like a nutcake, but I didn't believe it either until I did it, and I share it. Dr. Corley lost almost 50 pounds. His hypertension gone, his high cholesterol gone. So really, this is a home run for all of us. Light weights, Tai Chi, yoga, walking, light bike, get off the cross, whatever it is, and get off this, the miles and miles of running. Go into nature for a walk. I've been doing some painting today, and I got some pottery to deliver for Danielle, some books also, and we can put a whole package together, and I may start sending out some of my pottery also. And we got some onesies coming for the success. And remember, hold the success, don't let it go. But remember, your eggs, your sperm, donor sperm, donor embryos, a gestational carrier, adoption, and be happy in the journey, no matter where it is and where it's going and what you've been at so far. Jamie Lee, fresh or frozen for 40 and over? Both, by the way. And so if you're banking, we freeze, come back and do a thaw and transfer both day 3, day 5, and 6 and 7. A lot of it is, again, if what you're doing isn't working, switch it up. I see so many frozens or day 5, 6s that come back and do a fresh day 3 and they get a baby. I don't know which one's going to work. And we like to explain everything like we know the answer. I'm sorry, idiopathic, unexplained, we're idiots, we really don't know. But Kiltz says it's all inflammation. It's mostly food. Stress in the mind is that other component, but too much exercise, too much water is also a factor. So I hope I'm helping, by the way. Hey, Meg, how you doing? Pleasure. Let's see. And remember, from time to time, Thanksgiving, Christmas, the holidays, but when you really learn that you're in control of what goes in your Ferrari, no one else, you got to decide on what you want to put in the mind and the mouth. That is the home run, all right? And for everyone, all right? You know, from time to time, but not every day are you having all those carbs, the bread, the pasta, the yogurt, the milk, the cereal, the rice, deadly. I'm sorry, those round little oat cereal things that have the heart healthy on them, they are not heart healthy. And cholesterol, all this cholesterol stuff is idiotic. Johnny Bowden, I was reading his blog, amazing. And check out, I'm blanking on Jimmy Moore, Keto Clarity and Cholesterol Clarity, amazing stuff. I think it's La Vida Low Carb. He's really got some really great stuff. Kayla McClelland, recommendation on putting in 1 or 2 embryos, ultimately the patient's decision. You know, we got a lot of pressure from insurance, from government, from our organizations on 111. So we have to abide by that as much as possible because they'll take us and shut us down. We're not going to let that happen. So we really want to be diligent. Plus, you know, you get 2 in there and they split into 3 and you lose them at 20 weeks or you have severe abnormalities and problems. We don't want to cause that for you. So we really need to talk about it individually with your partner and help you make that decision. And sometimes we don't decide until the actual day of transfer. But if it's a thaw cycle, we need to know about it ahead of time. Let's see here. Mary Lou Costin, Keto is for everyone because inflammation affects the uterus and implantation if you're using donor eggs. It affects a gestational carrier. Gestational carriers need to do keto. When it's not working, it's keto, keto, keto. And Kiltz's keto is king. And remember the Lion King plan, the Ferrari, not the Yugo, not the pig. Remember, we're lions and Ferraris. And as a vegan vegetarian keto, you can do it. Add more fat, coconut, hemp seed oil, butter, cream, and separate the meals and really cook the carbs down. And beans and rice and pasta have a lot of antigens that are deadly for our bodies. So you have to be really, really, really careful in the whole process, by the way. How's everyone doing? Right? Keep it coming, keep it sharing, share with family, friends, and those that you just, hey, I heard you were trying to have a baby. Have you checked out CNY Fertility? I know Kiltz is a little crazy, but we are focused 24/7, 365 on this. And it isn't work. It's a pleasure. And some days I have to turn it off, by the way. I have to spend some time with Tia and my family, my friends, and downtime for myself in my pottery studio, doing painting, writing, sharing, and check out Mind, Body, Smile. And we have a keto book coming out soon, Kiltz's Keto, and we're really excited about our keto magazine also. So keep sharing what has worked for you, by the way. And I'm really grateful to everyone sharing answers, asking questions, and you see something you know, because I don't see all of them as they're coming through, by the way. I miss some of them, and I apologize. Becky Goldrich about closing we're going to probably not be closing. We're going to be cleaning throughout the day and throughout the time period. I've got some consultants to come in and give us some really great advice, so we're really glad about that. We want to make sure our team gets some time off over the holidays, and everyone, if you need to take it down, spend some time renewing, rejuvenating your mind, your body, your relationships, all of this. Go on a retreat. Tony Robbins, check him out. Amazing. The Destiny experience is really awesome, and walk on hot coals. And I know it feels like we're walking on hot coals through the day in this fertility journey every day, and they're just pouring them right on top of us. But we got to just take it slow and easy. The book, Gina Love, is probably going to come out in the springtime, and so we're really excited about it. You know, I am incorporating a little bit opposite of Kiltz's keto, but that's just all part of the process. I'm open to lots of ways, by the way. If what you're doing is working, you don't need to change it. If it's not, it's time to look to something completely opposite, mind-blowing, and that really is the key to this whole process. Positive vibes. Oh, Think and Grow Rich, The Power of Positive Thinking. If you haven't read The Shack, it's a challenging one, but it gives us a new inspiration, understanding of the philosophy of things like the New Testament. But look at the Bhagavad Gita, the Quran. Look at Buddhism, whatever it is, spirituality. Rhonda Byrne in The Secret. And Mind is the Master, James Allen. Amazing. And my Mind, Body, Smile has some choices out there that I found really helpful. And I do a ton of audiobooks. And it's a journey every day. Love, forgiveness, first of yourself and then everyone around you, even when it seems like it's not repairable, okay? But each of us needs to take the responsibility for healing our bodies, our minds, our souls, okay? Look in the mirror and say, I love you, by the way. Let's see, Jesse Mike Volker, how long does it take to get into your clinic? We are currently on our 5th IUI. Listen, you can get in tomorrow pretty much, but get a call into our team. Any issues, CNY Fertility. My text is 315-416-9872. I pass it on. My email, rkiltz@cnyfertility.com or robertkiltz@me.com. Now, listen, I get a lot of these, and I try my best to get to them. If you're not hearing, get to the portal, talk to the nurses. Hey, Dr. Kiltz, did you get to that one? And listen, I'm here to be inspiring for myself and all of us. You inspire me. We want to find ways that we can make it accessible, affordable. Remember, we provide the coverage, the payment plans that otherwise you wouldn't get anyplace else. We're working on it for the medications, Bankers Health Group. We're working with them, and Integrity Pharmacy, and there's lots of opportunities out there, by the way. 15 more minutes. I hope you're enjoying this, and we really are grateful for the sharing, the likes, the loves. I went and visited my friend Mike Berkeley, acupuncture down right next to Joel Batsoffin's office in Manhattan. Really cool, amazing healer. He turned me on to acupuncture 15 plus years ago, and grateful to the healers. Chiropractic. Chris with Dr. Verdialis is working with Kerr in Atlanta and adding chiropractic. My good friend Steve Wexler. And in the springtime, the health fair in Syracuse Nature Time is going to be bringing myself and Maria Emmerich to speak. So we're going to make sure that people can get a live forecast of that and come and visit. And we're going to work on coming and visiting your local areas and bringing this conversation. But share it around. Just share Kiltz's Keto with people who are struggling to lose weight or get rid of inflammation or other problems. It's a home amazing run. And a lot of what I'm working to share is not just for fertility. It's forever, before pregnancy, during pregnancy, after pregnancy. And remember that when you get pregnant, you gotta stay keto. It's kick-ass amazing. The fat that we carry, remember, the fat we're meant to get fat. The get fat gene is the best, most amazing gene of the universe. Because if you didn't have it 10,000 years ago, and even less time than that, if you were skinny, you were dead in a famine, a war. I'm sorry, it's crazy. And so our causes of disease today are not obesity, but the food we eat in excessive amounts, variety, and frequency. One meal a day, not 5 or 6. We're not grazing animals. We came down from the trees not to eat the grass, but eat the grass eaters. I'm not trying to be negative for any belief in food, by the way. I'm just giving you my thoughts and ideas. We can do it lots of different ways. It's true, we're omnivores. But we're not meant to eat the way we've been eating for the last 10,000 years is my bet. All right. Renee Fitzgerald, what name? Let's see. We named our embryos so that we can pray for them by name and make it real. After losing it all in a fire, we know that a blessing has come. All right. For all those suffering from fires and hurricanes, and whatever it is any of us are suffering from, we need to have a prayer. Heavenly Father, nature, universe, God, whatever it is in your spiritual nature, remember the vibration of the thinking is the creation of whatever you believe in. And the more positive thinking, the more we can help send the vibration, just like these devices are sending out energy to the universe. And our body is connecting with these things, and they're turning things on and off, and genes and inflammation or reducing inflammation, whatever it is. Never, ever, ever give up. Thank you, God, for this day. How amazingly grateful I am and thankful. It was really cool at Roz's house. They have with his brother Shaquille Shaq. They've been doing this Thanksgiving gratitude. Everyone around the table will spend either a minute or 10 minutes sharing what they're grateful for. And I've been doing something called the 3 Gs, gratitude, goals, and game plan on mind, body, smile for a long time, and check it out. It's really been helpful for me. I write it in my journal. I share it on the internet through Mind, Body, Smile. So I've been working to place more out there, by the way. Let's see. Listen, remember, if you're at CMI Fertility, the $3,900 is our cash price. Our $4,500 is our cash price, includes monitoring. There's a little bit extra if you want to go out 1, 2, 3, 4, or 5 years. A lot of this is making it just accessible and affordable to everyone out there. And there are some grants available. There may be some medication that's available through the drug companies, but you must put it out there on the internet. Ask. CBD's oil to use, Paula Catalano. So usually it's 15 to 30 milligrams, and you're using per dropper, and you're going to use about 1 to 2 droppers once or twice a day. And you got to titrate it a little bit. I always say stay low, move up a little bit rather than going high and then lowering it down. There's a lot of great stuff out there. Read. And our website has some really great stuff also. And so again, Atlanta, early December opening for monitoring. We're going to also be doing IUIs coming up soon, semen analysis, HSGs, blood draws. We'll be shipping them to Albany or Syracuse, by the way. And Kristen Green asked about entering for the free IVF. Once you're on, you're signed in, you're signed up. And all people need to do is come on for sign in and sign off, and that'll get them in the system, by the way. But we really want to encourage people to listen and learn. Your body's a Ferrari. The cause of infertility, of miscarriage, of all these things, preterm labor, delivery, is caused by inflammation, and food is the top-notch one. And the modern recommendations of a healthy diet, I'm sorry, in my belief, they're unhealthy. And you could turn around AMH levels, by the way. And I saw there was a mention there about AMH, but we've seen so many AMHs turn around. Suddenly women get pregnant, sperm's improved. We had a couple recently where we added HCG and Clomid to the guy, boosted his sperm. He had none. And basically no one could figure it out. So we just added it and bingo, they get pregnant naturally. So a lot of what we're talking about is helping people first get pregnant naturally, and then with some assistance, IUI or IVF. And remember, laparoscopy, hysteroscopy for endoinflammation. And for men, guys, and women, it's really, really important. Keto, slow it down, and for both sides, by the way. Is IVF my only option if I can still get pregnant naturally, but it never lasts past 6 weeks? Shannon Hill. All right. It's just an option, but keto, laparoscopy, hysteroscopy, antibiotics, LDN, CBD, and then a full immune protocol, intralipids, Lovenox, Plaquenil, prednisone, Neupogen, IVIG. And we have really a lot of improvement coming on, and we're working on IV hydration, IV vitamins and boosters and supplements that are really going to help our bodies soar. And remember, irritable bowel, colitis, Crohn's is all caused by a healthy standard American doctor recommended diet. Deadly for all of us. And I see a lot is going through. So therapeutic supplements, Ovavite, Ovasitol, the DHEA if you have a low AMH, the vitamin D, and the Theramegas. And the guys, Conception XR, and the Ovasitol for guys too, by the way, because I believe metabolic syndrome is happening for guys. So that's like PCOS. Someone asked about bulletproof coffee and adding boy, I can't even think of the word, MCT oil, coconut oil. And yes, you can, or butter. I don't add those to my coffee, by the way, but more of something isn't necessarily better. Less is best in so many ways. Jennifer, hello, Mrs. Carmen Romero, over 40 Acai supplements during IVF process. They may be helpful. Look at it, make sure there's not sugar in there. And there, a lot of these supplements have plant antigens, and so I really want to stay away from that. And let's see, Kina Brian Boussard, soda on keto. Coke products, soda products are not good for us. Although from time to time, simple sugars, I believe, are better than complex sugars. And so a little bit from time to time, but if you're really working to take care of the Ferraris, by the way, it doesn't matter your size, your shape, what other conditions are going on. Listen, you're a Ferrari already. The DNA is built into all of us, but the inflammation that flows through the body F's up our DNA, our mitochondria, all the cytoplasmic organelles. It just messes up the telomeres, everything, the spindle fibers. It's micro-inflammation, and microvascular inflammation is deadly, deadly, deadly. And suddenly people are getting cancers and strokes and irritable bowel colitis, and you're on all these drugs and you use this plant-based diet, which is crazy. We're not herbivores. We are carnivores mostly. But again, you can do vegan, vegetarian, keto, spread it out, cook them down, add a lot of fat. Oh, don't forget bone marrow soup. Bone marrow is really, really, and bone broth. Kim McCurry, with 2 Avadel shots, said the wrong one last time. Help with trigger maturation. It may be 2 is helpful. We think mostly for people that are of a higher BMI. Do 2, do 10,000 HCG, add the Lupron, and add the second trigger 12 hours after the first one. The first trigger is about 34 hours prior to retrieval, by the way. How's everyone doing? Really enjoying a few more minutes? Keep sharing. And remember, Atlanta, Dr. Verdialis. Let's see, Margaret Hoyt. What is the cause of high natural killer cells? All right. Natural killer cells are a sign, they're white cells, they're inflammation. They're a reaction to something we put in the mouth more than anything. The bowels get inflamed, colitis, Crohn's, appendicitis, gallbladder problems, pancreatic problems, everything, by the way. And so this is where our autoimmune diet comes in, our autoimmune protocols come in. They're tremendously helpful in all of this. So, it might be something that, I'm not allergic to avocados, but my daughter Pilar is allergic to avocados and bananas. And my bet is many of us are allergic to things that we don't even know it. So, and for all of those that hang in for the whole hour, I'm really grateful. To everyone that just comes on for a moment or two, I'm really grateful. And for the shares, the likes, the loves, and the passing it on, we want to pass 100,000 views. We want to get everyone checking this out so they can learn completely opposite natural ways that suddenly, even at 44, people are doing this and they're getting pregnant, delivering babies. And I know people say, oh my God, my AMH is so low, I'm too old, it'll never happen. That's negative. And we can't be negative Nellies. We got to be more positive on the Porsche and the Ferrari or the Lamborghini, whatever you afford, a Chevy, they're great cars. You need to be on that path that we're going to kick some ass, change it up, change how we care for this amazing thing. Remember, you are that amazing, irreplaceable, expensive, valuable. Begin to treat yourself that way every day, by the way. The 419, Yud, how you doing? 419 testosterone is fine, all right? But inflammation is the kick-ass killer for all of us. It gets the libido, the testes, the prostate, the seminal vessel, everything, by the way. So we really got to change it up. And the more we do that, everyone's going to feel better. And my friend Danny Vault at the York, amazing ribeye steak, by the way. That's where I got it. Now, I did have some French fries dipped in mayonnaise. I have a little bit high fat, by the way, and a little bit of simple carb. But Danny, the York is an awesome. Ask for Kiltz's ribeye, which is the tomahawk, but have it the Kiltz way. And check it out when you're in town at the York, and see what you think, by the way. Donor egg IVF in Albany or Syracuse, both are great, by the way. They all work nice. And listen, if we get your frozen eggs, donor eggs that are piss ass poopy and don't make it, we're going to help get some others. If they just don't fertilize for reasons we don't understand, it's often the same thing comes with standard IVF. But we have ways of making it more affordable for everyone. If you do an IVF cycle, you can add on some donor eggs for $1,000 an egg in the whole process. Kelly Michelle, let's see, Kristen Marie Peloso, how you doing? Let's see, PCOS is Kelly, currently trying to get pregnant. When would you recommend coming to CMI to get acclimate in anticipation for needed fertility assistance? All right, ask today, all right? Listen, a consultation, I was speaking to one person today, said, gee, my wife's friend simply called, made the appointment, heard about us, and suddenly she's pregnant. So we'll give some credit in all of that. But early is always better. Hey, I'm thinking I want to have a baby. I've tried for 3 months, not happening. Get on the line for an appointment. Watch these episodes and share it around. And it's 9 o'clock. And I'm going to get some early rest, early rise. And I'm grateful. I'm sorry if I wasn't able to get everyone's questions, but keep watching. Check us out. Gratitude, God bless to everyone out there. And through this really challenging holidays, or every day's challenging on this process, but find a way. Thank you, God, for the day and all the power of positivity that you bring me. God bless to everyone. Thanks for hanging in there.